Hello, I'm Dr. Greg Maguire with Neogenesis. Today I wanted to talk about our short poster, topical stem cell released molecules to both prevent and remediate inflammatory skin conditions. So this is a systems therapeutic because it's multiple molecules from the stem cells, and they're used to restore the physiology back to a normal state. So physiological renormalization. The product that we use is a topically applied product composed of the molecules released both from skin-derived mesenchymal stem cells and from fibroblasts. Includes growth factors, many growth factors in the mix, matrix proteins such as collagen and laminin, instruction set proteins telling different molecules how to bind together, such as HAPLN1. Also includes heat shock proteins to repair other proteins, including small heat shock proteins that can really penetrate. There are a number of lipids in the mix, including palmitoyl ethanolamide. It's a COX-2 inhibitor, reduces inflammation and pain. Many antioxidants, so protein antioxidants are a big factor in this mix of molecules. There are proteosomes, which help to take unrepairable proteins and recycle them, break them down into amino acids, and carry it to the lysosome. There's senescence reversing proteins. So these will help to reduce pro-inflammatory molecules from being released from senescent cells. So we bring cells out of senescence. And then, of course, immune modulating proteins. So these are proteins that will reset T cells and macrophages to a pro-healing, non-inflammatory state. So T cells will be regulated back towards Treg, for example, and macrophages from the M1 to the M2 state. So it's a pro-healing mix of immune modulators. A part of this delivery and protection of these molecules exists because of exosomes. So exosomes are about 50 to 80 nanometer in diameter particles, and packed within these exosomes that are naturally released from the fibroblast and from the stem cells are a bunch of different proteins. And I have a chapter that I can share with you for anyone who's interested. Packed within a typical exosome could be, depending on the size of the proteins, depending on how closely they're packed together, could be 20,000 proteins. And all of this means these proteins are packaged into a protection device, and it's also a delivery mechanism. These are exosomes with a lipid bilayer structure. They've been found to penetrate through the epidermis. And then once they penetrate through to the deeper layers of the skin, they'll open up and deliver their contents to the skin layers. So the Neogenesis core technologies I'm talking about is a combination of stem cell release molecules from multiple stem cell types. So what we have are multiple molecules, many different types of molecules. This is a systems therapeutic concept. And so these multiple molecule types, therefore, are targeting multiple pathways. So all skin conditions, skin diseases involve many different pathways. And so these molecules are targeting the different pathways underlying the condition of the skin. So all this will help to restore the normal protein and lipid content of the skin to renormalize the physiology. These are some of the examples. The first three, I'm showing you how we can remediate certain conditions. So the first, and these are all topical applications, no other treatments to the patients, nothing done to the pictures. These are just raw pictures out of the clinic. You can see the before and after in the actinic state. At the bottom left is a scar that had been reduced, and it was a thin scar. This was not a thick scar, but a thin scar that had been in this friend of a friend. I met her because she wanted to try the technology. She had had this scar for a year, and she began to topically apply the escroderm technology that we offer. And within a month, she really saw a significant reduction in the scarring. And after the 30 days, the scarring was, you had to look very close to see any faint halo of something that had happened there. And also we can prevent things such like such as radiation dermatitis. So this lady had to go in and be irradiated, and unbeknownst to us or unbeknownst to the physicians that were treating her, she began to use the S2M technology before treatment and during treatment. And like some of the other patients that have done the same, they don't see radiation dermatitis, or else it's greatly reduced. They just don't see the redness, the irritation, the brittleness of the skin. And she also had to have breast reconstruction, scalpel-based surgery, and the prevention of the scarring was pretty dramatic as well. So we'd like to use this technology in the right settings to both remediate, but with the work of physicians and their knowledge of doing so is to use the product beforehand for procedures to try and better prevent and give better outcomes for the procedure. So if you'd like to contact me, you can reach me at Greg Maguire or gmaguire@neogenesis.com. I'm always available by email, phone, or other means of chatting. And I thank you for your time.